Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop ankle pain. But before I do that, I'm gonna go over a basic ankle anatomy, the causes, the risk factor for ankle pain, and the normal healing cycle on how to treat the root cause of ankle pain at home. So this is the ankle. As you can see here, most of the ankle pain usually around this area. So we have a bone here called fibula and the tibia bone, and then we have the metatarsals, and you have your toes are here. So this is the outside part of your ankle, and this is the inside part. So when you have ankle pain, you could have it from ankle sprain, and it is typically happen on the outer side of the ankle. And you could have plantar fasciitis that's happening here in this area, bone spur, it's commonly here and sometimes in here. And you could have Achilles tendonitis in the back here. Or gout or rheumatoid arthritis. So these are all conditions that could cause ankle pain. And the most common causes and source of ankle pain is actually could be bad shoes. If you wear high heel or you wear not supportive shoes, that could cause pain, or causing plantar fasciitis, Achilles tendonitis, or it could cause bone spur. So footwear is very important. The other important thing is the way you walk. So if you're not using proper gait pattern, and I will have a video on that, how to walk correctly, you will stress the wrong area in your foot and ankle, and that could cause trauma and sprain or inflammation that could cause pain. So you can see in this image the three types of ankle alignment or anatomy. So in the middle is a neutral, which means that your calcaneus bone align directly underneath your tibia and fibula. So it's look a straight line here if we draw a line. And then we have a pronated foot, which mean it's actually going inward. It's hard to do it here in the model, but basically your foot collapsing inward, and that's pronated foot, and that's a risk factor for a lot of issue in the knee and also in the ankle. That could cause plantar fasciitis, Achilles tendonitis, and also supinated foot, which is your ankle actually more outward, and you can see it here. The feet is actually off the floor, and that's usually happen causing a high arch, and that could be a cause risk factor for Achilles tendonitis in the back. So why these are significant? Because that if you don't eliminate the risk factor for ankle pain, you're basically not getting to the root cause of the problem, and I will go over that in detail under treatment. So the other causes for ankle pain could be running, jumping, tennis, or playing sports with the bad anatomy. So you have a collapsed arch, or pronated foot, supinated foot, or your walking is funny, not walking the correct way. So you start to put mileage on your foot and ankle by doing sports that will increase your risk of having ankle issue. So running with worn out shoes, so that will not support your foot and could cause an issue. The other thing that's extremely common is tight calf muscles, and that's overlooked by a lot of people and healthcare providers. So you have your calf muscle is attached to your Achilles tendon here, and your calf muscle here attached all the way to your knee on the top. And that's a very common area of tightness, especially if you wear high heel or you wear bad shoes, and that will strain or cause tension on your Achilles tendon and could cause tension on your plantar fascia and cause plantar fasciitis. So it's very important to address the calf area with any ankle pain, because It's connected all the way to your foot and has significant effect of the stability of your ankle, and also give room for your ankle joint to be more flexible. So some of the diseases that actually could cause or have risk factors like psoriasis, high blood pressure, and if you take in medication like antibiotic or fluoroquinolone, that could cause ankle pain too. So how to treat ankle pain? Before I go over the treatment, we need to understand normal healing cycle. When we understand how our body heal, it makes a lot of sense what we should do to really treat the root cause of the problem of ankle pain instead of masking the symptoms. So I will use an external paper cut for visualization to visualize what's going on internally, but the same process happened with any ankle pain related to any injury. Doesn't matter the injury, plantar fasciitis, Achilles tendonitis, bone spur, ankle sprain, your body has to go through all these stages. And I have other videos that covering in detail Achilles tendonitis, plantar fasciitis, ankle sprain. You can check it out in my YouTube channel. So our body has to go through those 3 stages in order to heal. If it does not finish those 3 stages, you will probably stuck between inflammation and proliferation, going back and forth and not healing. So first stage is inflammation, swelling, redness, the blood starts to rush to that area, as you can see here in this image, and you start to experience pain. Second stage of healing is a proliferation stage. That's when your body starts to build the scar tissue. You can see the scar tissue here. If our body does not build the scar tissue, it's an open wound susceptible for infection. So actually scar tissue very essential for our survival. The problem is when you have excessive scar tissue, and that causes tightness in the calf and in your fascia or any soft tissue that limited the range of motion and cause internal inflammation added to the inflammation that occur from the injury itself. During the proliferation stage, there's a cascade of events: fascia restrictions, muscle spasm, trigger point. I'm just going to focus on the scar tissue for the sake of our time now, but I will touch base the fascia, how significant relieving the fascia system, because it's connected with majority of ankle injury. Perfect scenario, actually during the maturation stage, your body should get rid of the scar tissue, the inflammation, and everything clears up. That could take days, weeks, months, or years. As we get older, the process of the healing cycle decrease significantly. So if you have chronic ankle pain, you're probably going back and forth between inflammation and proliferation, which mean constant swelling internally and constant scarring that cause more pain. So to visualize internally, your muscle should look like nice and smooth, like the first image here on the left. And when you start to have injury or damage, it's kind of usually random like that in the second image, the strain. And when your body starts to build the scar tissue, that scar tissue extremely random. You can see it on the last image here. The problem is when you have too much of that scar tissue, it's kind of gonna like adhere the tissue together and prevent it from normal gliding and movement, and cause restriction, instability, discomfort, and actually that scar tissue could compress on nerve or artery and cause more nerve symptoms, numbness and tingling and other issues. So what should we do to treat ankle pain? I'm going to go over some of the current treatment that's not effective. We're going to relate that to the normal healing cycle, so it will make sense why you should not waste your time on these treatment and focus on treating the root cause of the problem, which is relevant to the normal healing cycle to get to the root cause of the problem. So one of the common things that been used is stem, ice, and heat. And based on the study, it provides temporary pain relief. But when you start to look at the healing cycle, that's not gonna do much to breaking the scar tissue, release fascia restrictions, or decreasing inflammation. So it's just temporary. So other things that commonly use massage is foam roller, and when I go over the fascia system, you will realize how impossible massage and foam roller are gonna cause effect on the healing cycle. The problem with massage and foam roller, if you have an open wound or internal inflamed area, you massage it, you rub it with the foam roller, you're gonna make it more inflamed. It's impossible with the foam roller and massage to go deep enough to cause deep release for the tissue, because especially with the massage, like using knuckles or elbow, it's not mechanically impossible to go deep enough. That's why I use a special tool to really do the release. So the other thing that's been used too is joint mobilization. Think about this way: your problem ankle sprain or plantar fasciitis or Achilles tendonitis or inflammation and scarring, if you just move the joint, which is joint mobilization, that's not really addressing the soft tissue, so it's irrelevant, and based on the study does not provide long-term pain reduction. The other thing that's commonly used is stretching, and I personally do not recommend the stretching to my patient, because based on the study it does not really provide significant improvement function wise, and actually overstretching will cause more inflammation. Think about this way: if you have a tear in the muscle and you keep stretching, what's going to happen? You're going to tear it more, you're going to cause more internal inflammation, you're going to cause more internal scar tissue. So I personally do not recommend stretching exercises. So the other thing has been used as strengthening exercises. That is one of the things I usually don't do, but I do something called function training, because based on the study, function training more effective than doing ankle pump. Teaching patient how to walk the right way, correcting the arch, that is more effective there to relieve the symptoms and getting to the root cause of the problem or the trigger, than just doing ankle pump and other exercises that, based on the study, is not really effective to relieve pain or actually transition to normal function. And the problem with the exercises, if you introduce it during the inflammation stage, it will make it more inflamed. So we need to do exercises, but we need to do the exercises that's effective to correct the structure problem that you might have. So what should we do at home? Okay, so for ankle sprain, make sure you watch the ankle sprain video that I have, because their protocol is slightly different than this. But for most of the stuff like plantar fasciitis, Achilles tendonitis, if you have inflammation, rest, avoid the motion that actually aggravates your symptoms. Then what I personally use, I use a Magna Heal 2. This is a very strong magnet. The range of the magnetic field is about 3 inches. So it can penetrate in the body. So that's what I personally give it to my patient to wear it throughout the day or at night to decrease localized inflammation. Also, I like to put all of my patient on an anti-inflammatory diet, because there's certain food that actually cause more internal inflammation that slow down the normal healing cycle. Some patients that have chronic inflammation and their body is just going back and forth between inflammation and proliferation, those patients typically they might have vitamins mineral deficiency. One of the things that you can do right now, you can take advantage of Ask ASTR. It's askastar.com. It's a free online medical evaluation. The software will help you and guide you through the process of knowing what possible vitamins and mineral deficiency that's required for normal healing. It takes about 5 minutes and it's free. So what should we do at the same time to really relieve the ankle pain? So as we see here, we have to work on inflammation stage, decreasing the inflammation. Simultaneously, we have to work on the scar tissue. For the scar tissue, we have to break the scar tissue. At the proliferation stage, we have to break the scar tissue, release the fascial restriction, and trigger points. So what I personally do is I use the A3 to release the superficial scar tissue, and I use the A5 to break deep scar tissue. And that's why I said massage and foam roller is not very effective, because it's impossible to go deep with the knuckle or the elbow to release deep adhesion. So I can do that with the A5, because with some areas in the body we can really go deep as 2 inches to 3 inches internally in the body with this tool. The other thing that's overlooked by a lot of healthcare providers, and I will briefly cover it here because I want you to appreciate the complexity of the fascia system. When you appreciate it, you will realize that's an important part of treating ankle pain. So the fascia system is divided to two groups: superficial fascia and deep fascia. Superficial fascia layer covering the entire body. It's one piece covering the whole body. And you can see the fascia here is a white web tissue in those images. And here, when you buy next time your stick, you will see those white filament, and those actually the fascia layer that's wrapping each individual group of muscles and actually group of fibers. To make things more complicated, but don't worry, the treatment is very simple. Each of those categories of fascia, the superficial and the deep is divided to 4 subcategories: apparatic fascia, epimysin, premiysin, endomysin. Each of these layers has 2 to 3 sublayers on the top of each other. So when you have a scar tissue, the scar tissue is actually gluing those layers together and preventing the elasticity of those fascia and actually compressing on the tissue underneath it. So it's a very important part of the treatment. We cannot pick and choose, okay, let me release the superficial layer and not releasing the endomysin layer, which is actually is not a full treatment, it's just a partial treatment. So the fascia system, the apparatic fascia, it's wrapping a group of muscles. Then we have the epimysin, and you can see it here, the epimysin wrapping each individual muscle fiber. Then we have the premiysin wrapping a bundle of fibers in here. And then at the end, each individual fiber is wrapped with the endomysin. That's why I said we cannot pick and choose which area to release it, and why foam roller and massage is not effective to release fascia, because with the knuckle it's impossible to get the premiysin, endomysin, and to release it, or the elbow. You need to have something really can go deep to do that release. So what I personally use to release the fascia system is I use the A1 to release superficial and apparatic fascia, and I use the A5 to release the epimysin, premiysin, and the endomysin. So to sum it up, what should we do at home to really relieve ankle pain? First of all, we need to address the root cause of the problem. So if you have pronated foot or supinated foot, we have to do exercises to correct that arch. Sometimes if there's some patient actually can correct the arch. I personally were able to correct my pronation with the exercises, and I will have it in other videos on my channel. Supination is the same thing. The other thing we have to address it is your gait. You have to walk the proper way of gait. So I will have other videos on it. One of the things that overlook is shoes. If you're wearing bad shoes, that will actually cause more issue, like high heel. So your shoes should not be, the heel should not be more than 1.5 inches heel. Otherwise, it's going to cause a lot of issue and could cause calf issues, Achilles tendonitis, or issue with your plantar fascia. So at the same time, while you're working on the inflammation, you have to work on a proliferation stage. You cannot pick and choose, okay, I'm gonna decrease the swelling with the Magna Heal, with the anti-inflammatory diet, and rest a little bit, but that will not break the adhesion. You cannot pick and choose, okay, I will release the scar tissue, but I'm not gonna work on the fascia system. That's not gonna be a full recovery or full treatment. So make sure you really address the whole issue from all the problems that exist that causing the issue. And that's conclude our video. I will see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.